In this PowerPoint, we'll discuss the bones of the upper extremity as well as the relevant landmarks. We're going to start with your scapula. Your scapula is more commonly referred to as your shoulder blade. This image shows your right shoulder blade. The image on the left shows the anterior or front view, and on the right side of the screen is the posterior or back view. There's a long ridge of bone called the spine of the scapula that you can actually feel if you take your left hand, place it onto your right scapula, and run from close to your vertebral spine out towards your shoulder at an angle. You'll be able to feel that. Near the end of it, out by your shoulder, it flattens and becomes a process called the acromion process, and you can see that on both images here. Below that, what you can't feel is a section called the glenoid cavity. That is a small area the size of a quarter and just slightly scooped out and angled. It's blue in this picture because it has articular cartilage, or cartilage in that it lives in a joint, and that's where the head of the humerus will attach. Above and below the glenoid cavity, you're going to see some bumps. And those bumps again are there because, like many other bumps, they're where muscles attach. You can see the supraglenoid tubercle, supra again meaning above, and infraglenoid tubercle as well, infra meaning below. In this image, you can see the borders of the scapula. Across the top is the superior border. On the outside, closest to your arm, is the lateral border. That's also called your axillary border because your axilla is your armpit. Closest to your spine will be the medial border, also called the vertebral border. At the very top, where the superior and medial borders meet, you can see the superior angle. And at the bottom, where the medial and lateral borders meet, you can find the inferior angle. The inferior angle will be important next semester and third semester. We use that as a common landmark to see how the scapula is aligned, to see how it's moving, but also to be able to move or mobilize the scapula. In this slide, you'll see the suprascapular notch, supra meaning above. This is a notch on the top of the scapula where a nerve runs through there. We talk about it because clinically what we'll see is some of our clients have a compression of that nerve and then weakness of the musculature around the shoulder because of it. The coracoid process is a unique process. It is something that starts on the scapula, which is on the back of your body, but because of its course traversing forward, you can actually feel it on the front of your chest. So it's this weird finger-like projection that allows muscles to attach to the front of the body, but actually to move the scapula itself. When we use the term fossa, we're talking about a scooped out area of bone. On the anterior image, you can see the subscapular fossa, sub meaning below, and this is a scooped out area or curved area of bone where a muscle lives, and this also meets up with the back of the rib cage. The image on the right is showing the posterior scapula again, and you can see the supraspinous fossa, meaning a scooped out area, and usually we have fossas because a muscle lives there. So in the supraspinous fossa is the supraspinatus muscle. So supra means above, spinous is referring to the spine. You can see the spine there. If we go below it, infra means below, so it makes sense that the scooped out area below there would be the infraspinous fossa. When we get done with this PowerPoint, come back to this slide, pause the PowerPoint, and see how many of those landmarks we just talked about you can find. The humerus is the upper arm bone. You can see the greater tubercle labeled to the left of this slide. That's a large area of bone, and it's large because it needs to be strong due to multiple muscles attaching there. To the right side, you can see the label for the lesser tubercle. As its name implies, it's smaller, although still an important attachment for muscles. between these is something called the intertubercular groove. Inter means between, like in an interstate. The intertubercular grooves lies between the two tubercles, and you have a tendon that runs through there that often gets irritated. The deltoid tuberosity is on the lateral or outside portion of your humerus, about a third of the way down. It gets its name from the muscle that inserts there. And at the distal or bottom end of the bone, you can see the lateral epicondyle, which would be located on the outside aspect of your elbow, and the medial epicondyle, and that would be the innermost portion of that humerus bone on the medial aspect of your elbow, which is where it kind of bumps up against your body. In this picture, you can see the anatomical neck and surgical neck. These aren't so much structures that you can point to as regions that we need to be aware of. The anatomical neck, it lies between the head of the humerus, which you can see in blue there, having a bunch of cartilage on it, and then the shaft of the bone. The surgical neck is probably more important because often when there's an injury or an incision needs to be made, such as in replacing the joint of the shoulder, they will make an incision at that surgical neck. At the distal or bottom end of the bone, you can see the capitulum and trochlea. They are covered in blue because there is cartilage there where it meets other bones. So that's where your forearm bones are going to meet that in your elbow. The capitulum is a rounded area, and it meets the radius bone that we'll study soon. The trochlea, you can see, has a different kind of wave-like structure, and it is where the ulna attaches at the elbow. Above there is the coronoid fossa. So that's where the coronoid process of the ulna is going to fit into when you flex your elbow to give you more range of motion. The posterior or back image of the humerus shows you the anatomical neck, the surgical neck, and as well as a new structure called the olecranon fossa. That's a fossa where the olecranon, or the big bony piece on the back of your elbow, is going to fit into when you straighten your elbow all the way. Here we can see the forearm bones. On the left is the radius, and on the right is the ulna. The radial head is kind of made up like a stack of quarters, where it's round on the outside, relatively flat on top, and that's going to articulate with the capitulum of the humerus. The radius then narrows at the radial neck, and then you have the long shaft at the radius. The radial tuberosity is a small piece of bone that sticks out. That is where the biceps tendon inserts. And then at the distal or furthest end of the radius is the radial styloid. If you have your hand palm up, and with your other hand you run your index finger along the outside of it down by the thumb, you'll feel a sharp edge at your wrist. That's the radial styloid. The ulna has several things to be aware of. The top of it is shaped like a C, and it wraps around the bottom of the humerus to make a very strong connection at the elbow. For that reason, it's really hard to dislocate your elbow. The front of the C is the coronoid process, and you can see that labeled here. You don't see the back portion called the olecranon process. We'll see that in the upcoming slide. The trochlear or semilunar notch is labeled, and it's hard to see from this image, but really it's a C-shaped structure, and from left to right it scoops up towards the middle, kind of like the crest of a wave, and we can see that better on the next slide. At the distal end of the ulna is the ulnar styloid, and that's a very small little bump that you can see sticking out the bottom, and that's often injured in wrist fractures. This image does not come from your book, but I've added it because I think it does a better job of showing you the trochlear or semilunar notch. You can see how it's C-shaped, but I think you can also tell from the shading how it goes from the sides and then scoops up in the middle like a wave. You can see the coronoid process and the olecranon process also in this picture. This is the posterior view. So again, you can see the olecranon process and another image of the ulnar styloid. The picture on the right does a great job of showing you the distal humerus and the top or proximal portion of the ulna and radius. So you can see how everything kind of fits together. Remember that this is a posterior image. Here's an image of the back or the dorsal surface of the hand. At the base of the hand is the carpus or the wrist, and the carpus is comprised of 2 rows of small bones. We're going to start with the proximal carpal row, or the ones that are closest to the radius and ulna. So we have on the thumb side, you have the scaphoid, the lunate, then the triquetrum, and the pisiform. Looking at the distal row, we're going to go back to the thumb side, and you can see the trapezium, the trapezoid, the large capitate in the middle, and then the hamate. So these are hard to remember, so usually you want to make some type of mnemonic or memory device. And to do that, you typically take the first letter of each word and assign a word to it. One example is, Sally left the party to take Kathy home. That would stand for scaphoid, lunate, triquetrum, so forth and such on. If we move distally, the next set of bones coming off the carpus are the metacarpals. So the metacarpals are like large carpals, and these are the ones that are in your palm. We label digits from the thumb as your first digit to your 5th digit, which is your small finger. So you can see 5 metacarpals there. You can see that they are covered at the end by that blue articular cartilage where they articulate or form a joint with the next set of bones. We're going to skip the thumb for now. Let's just focus on the fingers. So you can see the proximal phalanx is a single one, or phalanges would be multiple, right after the metacarpals. After those would be the middle phalanx for singular, or middle phalanges for multiple, and then the last ones are the distal phalanges. I left the thumb separate because it's unique. If you'll notice, in the index finger and all the other fingers, and you count them, including starting at the metacarpal, you end up having 4 bones. In the thumb, you'll notice there's only 3. It's missing one. That's why it's so much shorter than the other fingers. So in the thumb, we have the metacarpal, the proximal phalanx, and then the distal phalanx. There is no middle phalanx for the thumb. This is a Palmar view, looking at the front of your palm. So you'll see the same structures there, just a little different looking. We also need to talk about the joints of the hand. So the first joint, where the carpus meets the metacarpals, is the carpo-metacarpal joints. And there are 5 of them, the CMC joints. The next set, and we're going to stick with just the fingers for now, not the thumb, are the MCPs, or can also be abbreviated just MP, the metacarpophalangeal joints. So between the metacarpals and the phalanges. Next you have the proximal interphalangeal joints. Proximal meaning it's the one closest to the body. And interphalangeal, inter meaning between. So it's the proximal ones between the phalanges. And then the last joints are the distal interphalangeal joints. And you can see those labeled in purple. I haven't labeled all 4 of them just for simplicity visually, but those would be all 4 fingers. Now we move to the thumb. Again, we're missing a bone, so that means we're going to be missing a joint. So between the carpus and the metacarpal, again, is the carpometacarpal joint. That first CMC joint is important because it's common that we treat osteoarthritis at that joint. Between the metacarpal and the proximal phalanx is the metacarpal phalangeal joint, MCP joint. And then we only have one IP joint, so we just refer to it as the interphalangeal joint of the thumb. There's no DIP and PIP in the thumb. Some other terms to be aware of are the TFCC We'll cover this later, but it's the triangular fibrocartilage complex. You can't see it in this image, but I have a line going to where this would be. You've heard of the meniscus in your knee, I'm sure. This is a very similar structure. It's a strong fibrocartilaginous disc that goes in the wrist there, where that hole is, and it serves as a shock absorber and to take up that space and create some structure there for the carpus to fit into. It's very commonly injured, and often we end up treating it, and it's an area that a lot of people aren't familiar with. So we're kind of unique in our specialization in the hand and being able to pay attention to structures like that. You'll also hear terms P1, P2, and P3, and what those are referring to is P1 is your proximal phalanx, P2 is your middle phalanx, and P3 is your distal phalanx. So if we put all this together and we wanted to kind of put this in a clinical case, you might get a prescription to treat someone that has a left fifth P1 fracture. So take a minute and try to figure out where that would occur. So if you remember, the fifth digit is your small finger, and P1 is your proximal phalanx, so it would occur on the left small finger proximal phalanx.